I shit you not, literally reading the FDA website, and we were just like, what are the rules? We know creating medical devices are tens of millions of dollars. Is there a way to do it for like, I don't know, 50,000? And that's what we did.
Hey friends, this is Podcast Ruined by Software Engineer. On this episode, I get to talk to Dr. Amy Beckley, founder and CEO of Proov. Proov develops a suite of products to keep track of your hormones and help you achieve your fertility goals. If you enjoy Podcast Ruined by Software Engineer, don't forget to hit the follow button on your podcast app so you don't miss out on the new episodes. And you can pick up podcast merch at perrytiu.com/shop. Enjoy the episode. Welcome back to another episode of Podcast Ruined by Software Engineer. I'm your host, Perry, and today with me is Amy Beckley, founder and CEO of Proov. Amy, how are you today?
Doing awesome.
Nothing better than awesome, just like your products. No, I'm getting on that. I just wanted to put it into context that I think I keep on saying I'm very excited with these conversations. It's really like both ways, but also the fact that it's such a territory of like not only technology, but also, life and sciences and biology and like all these cycles and everything. I can't wait to dive into it. But maybe as just to help Perry out and maybe our listeners out a little bit, who is Amy and what is Proov?
So I am a scientist. I've also had a really horrible journey with my hormones that led me to have infertility, recurrent miscarriage, and as I go into menopause, horrible symptoms of menopause. So I took my scientific background and my life background and kind of mashed them together and decided I was going to improve women's lives and create better hormone testing products. Another thing during my journey is I didn't have doctors that really listened because our healthcare was broken. It was, you have to wait until you've lost 3 pregnancies. You have to wait till you've been infertile 12 months. And I'm like, this is ridiculous. You're pushing people to the brink of like mental breakdown when if we just gave us some information, we could be proactive about our health and lead to a better solution. So that's who I am. And what Proov is what I created. I started it in my basement with just I want to help women know more about their bodies. And if I make it and they buy it, I will make more. And so what it's turned into is a very comprehensive platform that monitors hormones across the menstrual cycle. So we can tell you everything from how many eggs you have left, what your fertile window is, are you having healthy ovulations so that you can actually get pregnant, and then do you have hormone imbalances that could lead to symptoms of menopause? Are you entering menopause? Where are you on that journey? So really uncovering the secrets of the hormones. Everything is urine-based, done at home through a phone app, a free app. So no needles, no sending samples, no waiting god-awful long times to get your data back.
That is, I'm going to say incredible in a sense of it's because there's people who go through this day to day who won't do anything about it. Do you know what I mean? There's always people that just life happens to them and then it's just like, oh, that's life. But then at the same time, not only helping yourself, but today you're helping millions of people, if anything, on a daily basis, right? So this is the contrast that I put into perspective where I get the absolute pleasure to spend a little bit of time to, the journey into founding Proov, but also the different product of Proov. But one thing that could probably also be interesting is this, you didn't wake up deciding you're going to get into this journey. Even the little aspect or the little thing that you shared with us that, hey, I'm going to try this and maybe it's going to work out. Maybe it's not going to work out. That's the fun part of how people deal with this. But were there any kind of influences, I guess, like growing up where you had maybe like a lot of entrepreneurs around you, or maybe you already had these like exposure to I guess like people jumping into ventures, or maybe even to begin with, where is home? Where did you grow up kind of thing?
So my journey started on the healthcare side and I was, a normal teenager. I grew up in Thousand Oaks, California, which is just north of Hollywood. And I just had headaches. And it was just, oh, you have headaches. Let's go to the doctor. Let's see if you get migraine medication or whatever. And then I just got such debilitating headaches that I was on the floor of the bathroom. I could not get up. And I went to the doctor, and instead of them kind of brushing me off and saying, oh, it's just migraines, it's normal, here's a pill. Hey, why don't we get you into the city, which is a 20-minute drive into the city, get you an MRI, see if there's anything going on. We just want to be extra cautious. I did not leave the hospital because they found a very large tumor that was cutting off the circulation of the fluid in the back of the brain. And they said at any point that could have burst and that could have been it. And so I was wheeled into surgery. It saved my life. And that one experience was like, wow, if I hadn't had that doctor who just said, why don't we just go the extra mile and figure it out? And then that one experience led me into seeing that not all doctors are like that. Not all healthcare systems allow you to do certain things. And that's where it kind of gave me that passion of wanting to do something to change healthcare. I started off wanting to be a doctor. I did pre-med and I volunteered in an ER, and I had to hold the hands of the arms while the doctor was doing stitches, and I almost passed out twice. And I'm like, okay, needles, blood, not for me. Why don't I be like the woman behind the man or woman? Would I, right? So like, what if I develop the tools that the doctors are using? What if I help with the medications, the devices, and kind of help on that area? So that's what got me into science. And so I moved to San Diego and worked in biotech companies and just fell in love with understanding how to develop drugs, how they work, how they help people, that whole process.
I can't miss the opportunity to ask you, when was the first time, or what was your first computer? The only reason why I keep on asking this, it's kind of like a tech show at the end of the day, and also a lot of stuff you do today is through technology, right? Whether it's the phone, whether it's any kind of application like that. So
Yeah.
maybe, do you remember any of
Oh,
it?
I 100% remember an Apple IIe. I was born in 1980, and that was like the big thing. The computer lab had these Apple IIes, and I remember the green screen, and there was no like formatting. You had to put like, the little paragraph things, and it would print out totally different than what the screen looked like. I'm like the cusp of millennial, like the cusp of like technology. And so it's interesting because I absolutely love science and hormones and monitoring hormones and all that amazing stuff. I am super app and phone illiterate. It's ridiculous. I luckily have a really amazing app team, an engineering team that can do it. But it's funny because I started this company to be a hormone monitoring company, and they were like little test strips where you could look at it and you can count the number of lines. And it was super easy at first. It's like one line positive, two lines negative. But then we started adding on hormones and adding complexity. And it's like, you got to have some system to bring it all together. And now we use the phone to take a picture and scan the image and tell you the exact hormone values, no looking and trying to figure it out yourself. And so I turned into having an app company, and I hate apps.
But life is always that fun, ironic part, because the thing is, like, if you were somebody who's already adept in like this language of technology and computers and apps and everything, it's hard to see what's wrong with it. It's hard to see what you can make better, what you can improve with any kind of these applications. So maybe that was secretly one of your strengths to even the project that you're working on today, always being able to be like, this is not as user friendly, for example, and you're able to pinpoint something out.
Yeah, the team is like, well, if Amy can find it, then it must be user friendly because it must be easy.
That could be one way of looking at it too. That's so good on that. But fun fact, actually, when I went to university, I did do physiology and math. I feel like that's what I got, like health sciences, into my university. And for me to just kind of grasp biochem, and then there was a lot of these biology classes and physiology classes. Was that basically similar to the path that you took when you went to, I believe, UC San Diego? Or was it slightly different, or maybe not your expectation when you got into there?
Yeah. So my major was animal physiology and neuroscience because of my experience and having, a neurologist that really, helped me through that. And that was the closest I could get was animal physiology and neuroscience. But it was all the same classes. I took physics, OChem, biology, chemistry, all those fun things. I would say I like them all. Physics was my absolute favorite. OChem could curl up and die. I hate it. It's like the worst subject.
Ditto. Like, I could say that 4 times, and I'll still believe, like, It's like trying to find the different elements of like the carbons, and then like how many carbons are in there. I have no idea.
It just doesn't make sense. I'm like, how did you get to that answer? Like, that does not make sense.
Like, it's not even math at that point. But this is the part where I'm trying to figure out at what point this like knowledge and this science helps you, put that into practice. Because I feel like one thing I treat academia at least is that you learn a lot of things, right? You learn about how, I guess, like elements are put together and physiology in terms of all the muscles, and maybe there's like 6 different one in your legs kind of thing. But then when you graduated, did you already have that same drive of just like cast the net really wide and see where you land from that point after you graduated your undergrad at that point?
Yeah, when I decided I was not going to go into med school and pre-med was not my thing, I got a job at a biotech company, and we were figuring out how drugs worked and affected cell systems. And so I would just sit there and do like cell culture and lab experiments, and I'd just be a lab rat the whole time. And I loved it. I loved every single moment of it. It was amazing, and I felt like I was like accomplishing so much. I was going to help so many people like with these drugs, make them more safe, more affordable. And so I asked my colleagues, hey, what do I need to do to make this the rest of my life? Right, here I am as this like undergrad, super green. Where do I go from here? What kind of degree do I need? And they said, you need a pharmacology degree. And so the pharmacist is who prescribe or who can dispense drugs. A pharmacologist is somebody who studies drug interactions. So there's the ones that study how if you took aspirin, what it would do to your cells, how that mechanism of action is. So that's what I did. I moved to Colorado, got in my lime green Hyundai Accent, drove to Colorado, and started grad school.
The way you're describing it, in that sense of it was really driven by curiosity and passion, and you had to ask the question to be like, how do I get to this point?
Yeah, I mean, I've talked about this before. People get really overwhelmed, like in job interviews. What's your 5-year plan? I don't know what my 5-year plan, but I know what my next step is. And so you get to the next step, and then you have to decide, do I want to go this way or do I want to go that way, right? And then you make that choice from there. If you think too much into it, like, life is not going to work out. You're going to be disappointed. You're going to be let down, right? And so what you have to do is you have to say, this is me today. Tomorrow, I want to take that. It's like Frogger, that game Frogger. I'm going to go to this next lily pad. And then from there, I'm going to see where the traffic is. Where's my next path? And that's always what I've done is like, okay, I want to do this for the rest of my life. What's the next step? Oh, go to school. And so the punchline is I went to school, and then I decided I didn't want to go back to biotech anymore. Right? So everything changes. You just think today, right now, this is my best path forward. I'm going to take this one. And then you just have to be open to opportunity and things that could happen to change whatever you think is going on.
It's really reassuring, especially the part where like you do not need to know your next 5 years. You do not need to know your 10 years. Like, take one step at a time. And at that time, when you took that step to your grad program and even post-grad program, was there a major, I guess, like, or the thesis basically, was it very defined? Did you already know what your thesis was, like, from day one into that program? Or was it slowly piecing it together and then it slowly clarified itself?
Yeah. So when you go to grad school, this particular program, we had to do rotations where you go into different labs and you learn and you kind of work for 3 months on that subject to kind of see if you like it or not. And so the first one that I did it was a Parkinson's lab, and they were trying to take, it was so cool. They were taking stem cells and they were transplanting them into the brain of these mice to try to prevent Parkinson's. And it was so cool. But here's my issue is I was doing surgery on these mice, and I'd have to get their little babies out and inject in their little brains and then put them back and pray and hope that they were okay and they would deliver. And I just realized I didn't want to be part of that. I didn't like needles. I don't like blood. I don't like surgery. Like, it's really cool stuff that someone else can do. And so the other rotation I did was in a breast cancer lab. And they were studying, breast cancer has different stages, 1, 2, 3, and 4. Once you get to 4, that's the dangerous one. But 1, 2, and 3, it's one of the easiest diseases to cure. You just remove it, and then it's done. It stays where it's at. But there was a transformation in cells that would basically travel and metastasize to other places like the lung, and that's what would basically kill you. That was like the horrible part of breast cancer. And so we were studying, what was that trick? What was that different mechanism that caused a cell to do that? And how do we prevent that? And so that really got me interested in hormone signaling and the female physiology, and like, wow, it's so intricate, and like, look at all these really cool things. And that's where I kind of changed the pathway to, I don't want to go back to a drug company with whatever drug. Like, I really want to focus on women's health. And so then I went all the way to North Carolina and did a postdoc in hormone signaling. So stress and what happens to your body when you're under too much stress and how your body changes.
I recently saw the movie Inside Out 2, I believe. I don't know if
I haven't seen it yet, so don't ruin it.
Okay, fair play. I mean, it was just funny how, like, when you're talking, there was a lot of these, like, moments of, like, oh, wait, maybe, like, between hormones, but also, like, just emotions and even just other chemicals in your brain. Like, I'm pretty sure a lot of that ties into everything on that. And actually, when you're doing these, like, more, I guess, sophisticated academia programs, do you remember any kind of, like, specific... This is a typical nerdy Perry question. What kind of software were you using? Like, I'm just genuinely curious, because like people would be like, I wrote my thing in LaTeX, for example, or like anything like that. Some people might be using it in Doc, but what do you remember of like the tools that you were using back then? Because I'm sure it's very different than some of the tools or software that you're using today.
Yeah, that was my first Mac, so I was introduced to a Mac and all the wonderfulness that it is. I think we were using a software called like Prism. And then it got discontinued, and actually we just moved, and I found the dongle that has the license on it, and I threw it away because they don't make that software anymore. I was like, my past is getting thrown in the trash. And then we had some software, EndNote or something, I think is what it was called, that would do all your references. So you have to do a lot of papers and pull a bunch of references, and then you have to format them in different ways, and every single journal has a different way to format it. And so there's a software that'll help you do that. We're writing a paper now, and I have the grad student. I'm like, you do that. I'm not doing that. I already passed that test of my life. Like, it's the worst thing in the world to have to format all these references in different ways. And so she has some really fancy new software that does it just like that. So, I mean, technology moves pretty quickly.
I never regret asking this question, because every time somebody shares something like that, I'm like, oh wait, there is that like pocket of whether industry or niche technology that people need, right? When you're talking about referencing, but even like maybe biographies in some other part of like maybe the law part of the world, like some people might need to have that tool at the end. So I'm a geek. I'm gonna go look into all this kind of fun stuff later. But then I like this part where you have this like conviction after studying, and congratulations on your PhD. It's been a while, but still congratulations. Anyways, it's never easy to go through all of that. You had this conviction of, no more, I guess, like pharmaceutical companies and drug studying and all that kind of stuff. And you really got hit with this, I guess, like direction in life of the women's health, right? It's probably one of the biggest hills to climb, if anything, to really understand and demystify everything. So maybe how did that lead you into the beginning of Proov? Because maybe it wasn't even called Proov back then, but yeah, you could share way more context than I can.
Yeah. I mean, I have a PhD, and so I've had 12 years of school, 4 years of college, 4 years of post. So I've had, 20 years of education? 20 years of my life I've spent in a classroom. I got married and decided to start a family. And I was shocked at the little amount of information I knew about how to conceive a child, about my hormones, my menstrual cycle, any of that stuff. Because the entire time I'm like, I'm just going to take this pill that's going to prevent me from getting pregnant because I'm in school. I got to study. I got to do this. I'm not ready for it. And so you just like, back your mind, and it's just something that you don't think about. And so going through that and just realizing, if I, a person who's been studying this her whole, almost her whole life, 20 years, and doesn't even know anything about this process, like what's happening with the rest of the world. And so, long story short is I went through IVF, two rounds of IVF, and that was because I was labeled as unexplained infertility. And I come to find out that that is the leading cause of infertility. The leading cause of infertility is something we don't even know what it is. That is a scary thing. And if you think about, well, okay, well, if I don't know what your problem is, how do you fix it? Well, they have this procedure called in vitro fertilization, or IVF. It is fantastic at getting you pregnant by bypassing your normal physiology to like get you, get as many of those things kind of like checked off. Oh, we don't need your tubes. Oh, you don't need to fertilize. We'll do that ourselves. And but it's very expensive. It's like $20,000 per cycle. And you can very, very quickly just blow through your life savings, trying to conceive a single child. I mean, the average live birth, if you are doing IVF, is $58,000. That is insane. And so, I went through that and I built a relationship with my doctor, and I was like, what the hell is broken here? Like, why am I unexplained infertile and having to do this? Like, talk to me, work with me. Like, what's going on? So we just had really good conversations. He's actually on my medical advisory board now. I still communicate with him. He's an amazing guy. What did we miss? What was it? Like, what's going on? Like, how do we? And so I was my own guinea pig, and I started doing things. And it turns out I had a very, very simple hormone deficiency that caused me to lose pregnancy after pregnancy. And so, very high level science, when you have to have an egg and a sperm in order to conceive. And so everyone says, okay, ovulation, that's the process of creating an egg and having it release. And that's what everybody focuses on, is the release of the egg. Oh, well, did you release the egg? Cool, then you're going to get pregnant. What they forgot to focus on is you have to have that egg fertilized. It has to go to the uterus where it implants and it becomes the pregnancy. And so we at Proov focus on that latter half of the cycle where the hormone called progesterone, so it's progestational hormone, progesterone, is produced, and it allows that embryo to implant and you to be pregnant, stay pregnant. And at any point this hormone drops, it is either called a miscarriage or preterm labor. And so we're not tested enough with a blood test because you're in a clinic, you can only do it so often. And so we developed this urine-based test that lets you test every single day so you can see, are these levels maintained, and it gives us more information about the menstrual cycle. So that's how Proov eventually got to where it was. And so, my first child is now 14. He's 2 rounds of IVF. His name is Cash. I tease him that because he took all our cash. And then my daughter was a simple progesterone prescription, a generic prescription. 2 months it took me to conceive her. She's almost 11. And I mean, that experience was like, it's life-changing to go from, a $40,000 pregnancy to a $10 generic prescription was literally all I needed, like mind blown. And it's because we just didn't have enough knowledge for that doctor to know. He didn't have the right diagnostic tests to do that. And so that's where I was like, all right, I got to do this. I got to create this. But that was really after a lot of my friends and family went through this too. Like seeing them all struggle, going through miscarriages, not able to conceive. They have hormone issues like endometriosis, PCOS, and taking my knowledge that I gained, it was like this whole other career I had on the side, and passing that knowledge off to them, and they would get pregnant one by one. And so that was really where it was like, I think this is a thing. Like, I think we could do this, and I think it would actually help a lot of people. And so after my postdoc, I got a faculty position in Kansas. So we had our son at the time. He was 1.5, and my husband says, I want to raise my son as a wildcat. So he's from Manhattan, Kansas, the Little Apple, and he wanted to move back, which is great. Love being near family when you're have young kids. Got a faculty position, and part of that faculty position was you got tuition credits. So here I am with a 2-year-old, and I'm pregnant with a full-time faculty position, taking business classes in my lunch break because I wanted to know how to run a business. I'm a scientist. I know science. I don't know business. I have no idea what business is. So I just started taking these MBA classes one at a time to learn what do I need for business? What does it take? And I really love the business classes. They were like, I would say almost more awesome than my science classes. And then I think that it kind of clicked to me where it was like, we got to marry these two and create a business that's going to create this test.
One thing that was actually cool was that, okay, number one, the word you use, simple. Simple hormone deficiency. Like, it was, not that it was obvious, but it was ready to be solved. It was ready to be addressed. And I'm so glad that you mentioned that perspective of spending the time of doing it, right? Spending the time of looking into that. But one thing that I probably could ask you is the part of you finding out about this deficiency, was it similarly to currently what people do with like urine tests and everything, or was it something different in the sense of how was it done back then compared to how it's done today?
Yeah. So they do what's called a cycle day 21 progesterone blood test, which is supposed to be 7 days after you release the egg or you ovulate. You do a blood test and it measures the level of progesterone in your blood. And that's going to tell you yes or no, did you release an egg or not? And that level is between 0 and 50, 100, 200 if you're in pregnancy. And then there's like thresholds where it has to be above 5 to confirm ovulation. And then if you go to reproductive endocrinologists or functional medicine doctors, they actually want that level to be above 10 or almost 15. Some even say 20, because they know that you need a lot of this hormone to kind of help with that pregnancy and give you the best possible chance. And so I got these lab results and they were within normal ranges, right? Remember, I told you 5 is normal. So is 20, 30. And so I was down at like 7 or 8. And so I was technically in the normal range. So it was like, yep, you're ovulating. Obviously, you're getting pregnant. Everything's fine. But what they were missing was a couple days later, I would start my period and I would either have a miscarriage or not get pregnant. And if you think about the process of ovulation, your ovary is on the side of your body. That's where fertilization happens. So the sperm has to swim up the fallopian tube, meet the egg, and then it fertilizes. It's got to go all the way back down the fallopian tube into the uterus, and it has to dig its way in there and implant. That whole process takes 7 to 10 days. And so if you get your period before that 7 to 10 day period happens, you don't have enough time for that to implant. And so that's what was happening is, yes, I had progesterone then, but it was petering out too soon, and that was the deficiency. And so by adding it into my system, it prolonged from when, I released the egg to when I got the period. That allowed for enough time for implantation, and then my body would not start its period. And so, blood test is great for that one moment in time. And you could go in, you could say, hey, you have to go in for a blood test 5 days in a row. I mean, that's a lot to ask for somebody to do. And so we just do it in urine. We use a metabolite of urine called metabolite of progesterone called PDG. And you first pee of your day, you dip a strip, take a picture in the app, and it tells you your level. And then we just track it over time to make sure you have elevated and sustained levels, which really shows like a healthy cycle. Dropping progesterone causes things like infertility, miscarriage. It also causes things like PMS, heavy periods, painful periods. And then now, I get to deal with perimenopause and the cycle where your ovaries stop working and then you get these hormone imbalances. So there's a lot of really amazing things that progesterone does. And so that's kind of the backbone is there was no at-home progesterone test that existed. There was nothing. And so I went into literature and I'm like, oh, there's this thing you can measure in urine. We just don't have a test that measures it. There's all this literature that shows that this is the value it's got to hit. This is a healthy level. This is when it comes up, when it comes down. All this amazing research. There just was no physical product that you could go buy at the store and use. And that's what we did is we took the science from the lab and from these amazing researchers at universities, turned it into a commercial product. And so that's where I needed the business part of it. And then the science part of it was like, okay, how do you create this? You know, who do I talk to make it? All that fun stuff.
I don't know if this is the sexy or unsexy part, but we would definitely talk about like how you get the products in people's hands, right? If we talk about Proov, I mean, it's been quite a journey so far, almost a decade if I'm not mistaken, of just like really helping out so many people. What was that first product? What did that look like?
Yeah, I mean, the first product was just a simple test strip that you dip in urine and then you know, read the number of lines. So it's red lines. It's 1 line was positive, 2 was negative. It really looks like a pregnancy test with all the plastic and stuff stripped off. That's what it looked like. I mean, now COVID tests are the same thing, right? You're looking for the red lines. Is there 1 or is there 2? So that's basically what it was. And so that it's called lateral flow. That technology has been in existence since the 70s, right? Pregnancy tests, ovulation tests, COVID tests, flu tests, they're all built on that kind of technology. And so that's what we did is like, okay, we're going to build it on this platform. We just need to find the reagents and how to make it work and a manufacturer that can do it, because it's a medical device. It is regulated by the FDA. There's a whole bunch of rules. You know, we decided, you know what, we're going to do it. We're going to make this product. It's going to be great. And so I flew to Nashville, where my co-founder lived. And we sat in the Holiday Inn little breakfast area with our computers open. I shit you not, literally reading the FDA website. Okay, this is what this says. Okay, we need this, we need that. And we were just like, what are the rules? Right? And so we were like, we're going to do this. And we know creating medical devices are tens of millions of dollars, like creating pharmaceuticals with tens of millions of dollars. Is there a way to do it for like, I don't know, 50,000? No. And that's what we did. I mean, that was our goal, was to do something in an FDA compliant way where we were following the rules. But you can follow the rules in your own unique pattern. You don't have to do what everybody else is doing.
I personally am like intimidated by not only just the FDA, of course, it sounds very aggressive to begin with, but
oh, trust me, I am too.
We're all compliant. That's the important part. When I was saying intimidated is because, yeah, as you're describing these like medical technology, the medical devices, the cycle of them, as far as I know, decades, right? You know, you have like products out there, like people that are producing toys or video games that come out every year or maybe even half a year kind of thing, or even less at some point. But then every time somebody mentions, whether it's like in healthcare or medical devices or any even drugs at that point, it's decades, if not 2 decades, if 3 decades. So maybe if I could like pick your brain a little bit on that process of like, shout out to docs, by the way. I feel like you also know this as somebody who probably like just runs a bunch of different projects, that docs are super important, like documentation, because somebody needs to read it. Somebody needs to know how to do it. But yeah, that moment there, you read a lot of the docs, and then from that point, was it just making like an LLC and be like, okay, let's put the money into like the Delaware C Corp and just like do that? Or maybe like, yeah, more on the lower level of like the business side, was it just forget about making company, just do stuff, just keep on doing things and then at some point incorporate after? Or
yeah, I mean, my co-founder was a patent attorney, so she knew how to like file those papers. So, and then we did a provisional patent right away. So that was really good. I highly recommend your co-founder be a lawyer of some sort, because you save a whole bunch of money. But I think we were just at the right place at the right time, and we had the strong enough desire to make it happen that we just figured out how to make it happen. The FDA is a super complex organization, but they regulate things differently. And so they do classifications on their devices. So there's class 1, 2, and 3. And class 1 is like low risk devices. A band aid is a class 1 medical device. A syringe is a class 1 medical device. A needle, class 1 medical device. And then you go up into 2 and 3. 3 is your heart valves, your stents. Like life saving, if this malfunctions, like you just killed somebody. Like really intense stuff. Those are super expensive, take a long time because you are dealing with someone's human life. Then there's class 2, which is like a pregnancy test, like a COVID test, where if you get it wrong, it does have a health impact and it could be harmful, but it's not like life-threatening. So we found out that our device was actually a class 1 device. It was a low risk. We're just helping you monitor hormones. It's not life or death and anything like that. And so we just read at like all the regulations, what do you have to do for class 1? Like, where do you manufacture? What kind of certifications do they have? And we just realized that we could do it, given the classification of the device and what we had learned that, we could do a certain thing. And then I think the really cool thing that I don't know if I'd say most proud, but very proud of, is that we actually did a crowdfunding campaign where we told people, this is the thing we're going to make. If you want it, like buy it and then we'll make it and then we'll give it to you. Because we needed to find money, right? I'm just this weirdo scientist who's going to, MBA school with these 2 kids and had this weird thing happen to her in the middle of Kansas. No VC is going to like, hey, here's a couple mil, go. So had to find a way to get money. And so we did crowdfunding and, we got $44,000 and that was enough to do initial prototypes, so to make the device itself. And then we had, well, how are we going to test the device? How are we going to see if it's accurate? Well, these people that bought the product, they were very willing to enroll in our clinical study and do it. And so people basically paid us to validate the technology. And so you just have to think about ways to kind of get around the problem and like, hey, you have this willing group of people that wants this. Why don't you just give it to them and tell them it's a investigational use device, collect the data you need to do, right? And so that's what we did. We did through a couple rounds of validation to make sure we had the right product, and then launched it. Did crowdfunding in April. We launched it in February. So it took us about 10 months to create a validated FDA-regulated medical device.
And the thing is, like, the cool part, you leverage what you knew already in the sense of how do you run maybe some of these studies, right? Maybe from back then, you already had a lot of exposure of how to have a group of individuals and making sure you collect the correct data, as opposed to just like any data possible at that point. So I feel like it's all these steps that, of course, looking back, it's like, oh, that happened, blah, 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 but it's meaningful. Without those steps, you would have never figured out if the product worked or not. And QA is very, very important when it comes to not only hardware, but also software. One thing I probably want to double click real quickly is when we talk about maybe like the apps today or the technology today that comes with the hardware, I guess. In this journey of having a product that you're sending out to people, shipping to people, and they're using it, were you already able to have them, I guess, like go on a website to input their data? Or how exactly was that collection or just making sure of the results like happened? Did you already have an app back then for them to just open and submit it on their phone? Or what was that, I guess, relationship?
Yeah, no. So we had an instruction manual. It actually still exists to this day. It's like a little pamphlet that you put inside the product and you open it up and there's this little chart. And it basically says, these are the days of the cycle you're going to test, and there's a little box for you to write in if it was positive or negative on there. And so it was you look at it, visually look at it and go, okay, that one was positive, put a positive in that line, and then, right? And so it still exists today, but I'm almost guaranteed that nobody uses it because everyone is just so glued to their phone. And that was I call it subjective, right? So it's kind of called line eyes, right? So when you're in the middle of trying to conceive and you're looking at pregnancy tests, you're looking for the second line. You are like turning it sideways, and there's like these apps that'll like invert it so it's like black and they'll look for the white line, and like it's just they're looking for the second line and they're studying it and they're seeing like faint things because they want to know the minute they're pregnant. And so our test turns positive when one line and it's negative with two lines. But the point at which it turns from two lines to one line was different across women because of their I don't see a line. Wait, I do, right? And so that's where we realized we need some kind of objective thing that we can really quantitate and give a true quantitative number answer. And that's where we developed the app technology. It is a really intricate process that is very, very advanced. I mean, it's one of the most advanced technologies out there. I remember when COVID first came out and they had an app that would come out and it would like help you read the test. And I remember downloading it and it would goes, okay, take your test. You're like, okay, I took the test. Okay. All right, open it up. Do you see one line or two lines? And you go, okay, I see two lines. Then they're like, okay, now look super closely. Are you sure you don't see a second line right there? And then you have to go in and you go, okay, no, I don't. That was their amazing COVID app. And I'm like, holy crap, we have been like running circles around you because we're not only reading one line, we're reading 4 lines and we're giving quantitative hormone analysis. And then we're building that to tell you what the hormones actually mean. So it's a super complicated product that is leaps and bounds past everything else, right? So if you were to take our tech and apply it to cancer detection, or like there's so many other things you could do and you can understand using the same core technology stack that we're using. So, you know, we had to get really sophisticated because the woman's body is so complex. Like it's not a simple system. But me being like a very sciencey person, there has to be an answer. There has to be a yes, no, this is good, this is bad, right? And so we're just really obsessed about learning about hormones.
I'm with you on both fronts, right? Of just like knowing more about the body and everything, but on the other side of the code never lies. To an extent, the line of code never lies at that point. It's like a truth, right? I mean, I don't know if it's a can of worms. I don't know if I want to jump into this more than anything, but I do agree with the sentiment of when we were talking about the COVID tests and everything, like the apps were kind of dumb. But at some point, I also built an app that also like kind of helped out the COVID stuff. Anyways, what I'm saying is the human, when you translate the human perception into the apps, there's always some area of misunderstanding or anything. Even the faded part, like how faded that line is, could like be a yes or no depending on who you ask it. Like who you ask that question to. So that's why I agree with you. Thank you for building this like technology behind it. Is it the path where, as you were saying, you could scan the test itself? Is that what it is? Where somebody would do the urine test with the, for example, the fertility test of Proov, and then they'd be able to scan it. And I'm assuming there's some like maybe object recognition, so maybe some like OCR to be able to do that. Or am I in like the wrong, I guess, lane, like the wrong lane in thinking of what this tech is at the end? I don't know how much you can share on this. This is just Perry trying to love technology and understand how that works.
Yeah, so yeah, it's multi-step process. So the first step is, yeah, you know, wait 10 minutes and then you take a picture of the test. And so the first part that we have to do is we have to cut out the testing window. And so that is training the system to know, hey, that's a PDG test, that's a ovulation test, that's a pregnancy test, and train it to see what it looks like. And so each one of our tests looks different. And so it knows this is the testing window. So that's step 1. And that's the, I don't know, I wouldn't call it machine learning. I wouldn't call it AI, more like machine learning, you know, object recognition, pattern recognition, those kind of things to train that model. But then once we have the testing window, that's where our proprietary IP comes in. It's actually patented. So you can go look it up because it is public knowledge. But basically what we do is we take that testing window and we scan across it multiple times and we read the intensities of the lines as it passes, and we have checks and balance to make sure there's no hair or debris or dust on there, that there's no lighting issues, there's no shadow. When you went down like this, do you have your shadow of your hair in your, frame? We make sure the lines are consistent. They are where they're supposed to be. And, when it passes all those things, then it goes back and we calibrate each lot to its own hormone calibration. So we spike in urine sample different hormones and we match it with that, and we build these for a lot so that we can say, hey, that line was 10 intensity. 10 correlates to a value of 15 for PDG. And so that's how we're able to read the hormones and translate it into actual hormone concentrations. And it took a long time to do because it's a really complex problem. You have all these people taking pictures with different phones, with different cameras at different angles. I mean, I'm like, oh yeah, you just take a picture, just do it like this. And then we did user research and it was like, what? Why would you even take a picture that way? Like, you're just learning so much about human nature and like what people do. It's like mind-boggling. I'm like, wow, no idea people use their phone that way.
In the middle of the night, just taking a photo. Yeah, we've seen all those kind of stuff. I'm assuming you've seen all those kind of stuff. But I love this part of the show, I guess, of where just like, if you think of course, it's a real life problem, right? Humans involved and all that kind of stuff. And then you break it down into a technological problem where it's like, how many if conditions you have at the end to check every single condition of debris, hair, of like shadowing, smudges in there, and just like, maybe we need to unsmudge it with some Photoshop command line tool or something. I don't know. There's a lot of fun stuff, but thank you for sharing a lot of that. And if there's a patent out there, I might just read it for the hell of it because I love looking into that kind of stuff. One thing I do also want to mention is the word iteration. And what I mean by that is that, of course, the fertility test has a lot of iteration to it, but also not just that single product, but all the different other products. When we're talking about fertility tests, but I was talking about cycle support and fertility treatment and all these other ones. How did that happen in the sense of the iteration? At what point did you realize that, hey, we are at a good spot maybe with what we currently have with this single product, and then diving into even the men's side of, I believe there's also a sperm test that is available as well. So yeah. I'm talking about this like branching out this width, right? Like, how did that happen?
Yeah, I mean, it stemmed from our users taking the test and then having nowhere to go to get the solution, right? So like for me, the solution was, oh, I had low progesterone. I'm going to take progesterone. That's a prescription medication you need a doctor for. And so, doctors are one, human, and technology moves at the speed of light, and there's constantly new things going out, new papers being published, all that stuff. And they're trying to be a doctor and treat patients and save lives and all that fun stuff. There's only so much knowledge a doctor has and then when. And so what we were seeing is we were building this new technology, this new way of thinking, this new diagnostic tool, and doctors didn't know about it. And so you have this woman coming in to tell this doctor something that they had no idea even existed. Where'd you buy that? They're like, Amazon. And they're like, wait a minute. I'm not going to trust anything off Amazon, right? So you can see how it's just how it happens, right? And so we decided we're not going to rely on doctors and them catching up to how technology is going. We're going to enable the solutions ourselves. If they had, a issue, we could connect them straight to a doctor, right? So we have a doctor that prescribes progesterone when they're medically qualified. Maybe you just need a supplement. So there's a lot of women that have really bad cycles because they're stressed out. They're getting a little bit older. Their diet's not so healthy. They're not exercising enough. And so if you supplement and you help your body build those hormones, you can have a healthy cycle again. And so then, increases your chance of getting pregnant. And so we knew what the problem was and how to fix it. And so we're like, well, we created the test by ourselves. Let's just create the solutions by ourselves and kind of be that full solution. And so I call it completing the treatment loop, because nobody likes, could you imagine like, oh, yep, you got COVID. All right, see ya. Like, bye. Like nobody wants that. It's like, well, give me the drugs, give me the meds. Like, tell me what to do. How long am I going to be sick? Like, fix it, man, fix it. um, so that's why we did that. On the male side is we found out that women are taking 100% of the blame, of the burden, of everything on trying to conceive. And they just think it's me. Oh, I got to track my cycle. Oh, we didn't hit the fertile window. I have to do something this way, whatever, whatever. And in reality, it's 50% of the time it's his fault. There's actually called spermageddon, is that sperm rates have decreased in the last 50 years, 50%. And if it keeps going in that trajectory, I think, don't quote me on this, but I think it's somewhere around like 2080, there will be no more sperm left and like humanity will cease to exist. Now, I don't think that's going to happen, but like you can see that sperm counts are decreasing. And it's pollution, it's diet, it's exercise, it's stress, it's smoking, it's all this stuff. Plastics, they just had this study that plastics are in the testes, I guess. So we're like, well, we have this captive audience of women. Why don't we educate them about the male? And then we learned, well, men, rightfully so, don't want to go into a clinic and have to collect a sample in that horrible environment. Like, it's almost impossible because of what you need to do to collect a sperm sample. And so we're like, okay, let's do a home test and let's make it fun. Let's make it as enjoyable as possible because we want the couple to be in it together. It takes a sperm, it takes an egg. When you get the couple together, doing it together, it really, really helps. And so we partner with a company and we have what's called Yo, and it is a at-home sperm test that is a little microscope. And you collect this sample at home, you put it on this little microscope slide, it connects to your phone, and you get to see a little video of your little swimmers swimming across. And we found that men just really love that. They don't have to go anywhere. It's super private. They get really cool results, and it helped that conversation. And so it's one of our, best-selling products. So we call it the Hers and His Kit. So if you did that, it's $170, and it screens for up to 87% of the leading causes of infertility at home. That's like less than a single reproductive endocrinologist visit. Like when you walk in the door, it's at least $450. And so if you can do something like that at home for such a low cost and educate yourself and come in there with that knowledge, maybe you don't need to go to an RE. Maybe you can get the help at the OB, or maybe you can use something that we sell, or, we refer you to, maybe he just needs a male supplement, right? We can refer you to brands that do that. So, our goal is to bring people solutions. And if they don't have to do IVF, like, let's not have you do IVF. Let's save that money, put it in a retirement fund or a college fund or car, anything.
And the thing is, it's life-changing, as you were saying. It's like, it's a test that you managed to make it enjoyable, and it's life-changing. It's something that will definitely, whether impact the people involved or even just have another outlook on life. I think that's something that is so fun to hear. And the other, I guess, pseudo lesson that was kind of given while you were telling how you treated this like iteration of different product was mostly like, who's really stopping you? Every time you come up with, whether it's like the demand or whether you were thinking about like, oh, what about this part of the cycle? What about this little gap that we could fill? It's about just being like, let's do it. There's not, of course, you're going through the regulations and everything, but even just the initial intent has always been just this drive. And I think that's one of the hardest lessons for everyone. But you're sharing so many of it that it's hard to discount that at the end of the day.
Yeah. I mean, healthcare is turning into consumer healthcare. It used to be you, the patient, goes to the doctor and they kind of hold all the keys into whatever. And now it's turning into, oh, I want X, Y, and Z drug. Okay, I'm going to go on the internet and find who's going to give me that drug. I mean, that's like Roe. They started off and they with, ED, and now they're in like weight loss and skin and all this other stuff, right? And so people are taking more ownership of their body and they're finding solutions and they don't want they don't want roadblocks anymore. They don't want to have to deal with people saying no. They're going to find what it is they want and figure out a way to get it.
And thanks for removing the roadblocks. Thanks for clearing out the way for a lot of people onto that way. So that's amazing. This is probably a question from Perry more than anything, is you do work with a lot of people nowadays as part of your team and everything. Maybe I ask myself this, like when you work in an organization that evolves and everything, what comes first, what comes second? Do you put more time? Did you invest everything into technology first? Did you invest everything into the supply chain first? Did you invest everything in marketing first? Did you invest everything in operations first? Did you invest everything in support first? Like, I don't know if you think about this day to day, you probably do, but maybe from your perspective of the evolution of Proov till today, I guess, like, what came first? Was it intentional? I guess, like, which team kind of pieced itself together first? Like, I'm always a geek about hearing that kind of entrepreneurial mind at that point.
Yeah, so definitely the tech came first. I mean, we needed to make sure it worked and it was a viable product before anything else. So when we launched the product, I mean, I'm not gonna lie, it was really shady looking. It was this white thing that said like urine progesterone test on it with a lot and an expiration date, and it came in a plastic bag. We sold it on Amazon, and I mean, it was a medical device. It had all the stuff you need for a medical device, but it had no branding, none, no marketing. It was just put on Amazon. But we really wanted to make sure it was a product and it was helping people, and we got it right, and it was, you know, fitting a consumer need. And so we did that for about a year before we actually came up with Proov, the name, and a brand, and put it in a box and built a website and all that stuff. So it was the product first. You need to make sure your product works. You know, somebody told me you can't market around a bad product. So you can spend all this money, but if your product is intrinsically bad, like, it's not going to go anywhere.
I think that's very powerful in every aspect of you can market a bad product. And I can't let you go without asking you about this specific thing. Ashanti, Nelly, partners with Proov. How did that happen? And as you may or may not know, I absolutely love Ashanti. I absolutely love Nelly growing up and everything. So I had to ask about this.
Yeah. No, so it was funny. So they emailed us, and we have one woman who lives in France, and she's Romanian, and she got this email that said, "Oh, this is from Nelly, and we want to see if you want to partner with Nelly and Ashanti on something." And she's like, "I don't know who these people are, but maybe you want to respond to this." Like, how do you not know these people? So that was a running joke for a while, but I was like, yeah, let's, give them 30 minutes, figure out what it is. And, she's 43. Yeah, she'll turn 44 at the end of this year. And she just didn't find her person, didn't reconnect with Nelly until later in life, and just really became passionate about women's health and advocating, and is just a really healthy person. And their experience was like, we want to kind of help grow and help educate and use our platforms to help educate people about this, because it affects everyone. She's like, I was getting my hair done and my hairdresser has fertility issues. I mean, everybody around you have issues, and so that's kind of how it started. Was, they reached out to us, and I mean, I got to meet them. They're really awesome. Nelly was opening for Janet Jackson here in Denver, and so they're like, yeah, come bring your whole family. So we got to meet him. And it was like 2 days before my son's birthday, and so he's like, hold on, let me get you an early birthday present. Called somebody on the phone, and somebody came running across the parking lot with some Air Force Ones. And so he is like super stoked. He's like, yeah, Nelly gave me these. And so everyone's like, because he's 14, everyone's like, who's Nelly? And so he's like, playing the music. I'm like, yes, keep it alive, keep it alive.
Yeah, get the dilemma going and everything. But my goodness, that is such a great story in the sense of, it's because that partnership is, the whole point is that it makes me talking about it. It makes a lot of people talk about it. And this is something that should be absolutely talked about, right? infertility, how helping people out, Proov, the whole I guess like mission behind it. I think that's been absolutely great on that. So I guess my last question probably would be, I guess for all the entrepreneur people out there, or even just like people just living through life of maybe ups and downs and all of that, whether intentional or not, I guess like what would be the best advice that you would have of how to treat life when life treats you a certain way? Do you just channel all your energy into anger, into just ingenuity and putting it into business? Like from your experience, what would you have to say to people in those, I guess, living that part of their life at the moment?
Yeah, I mean, I scrappy, stubborn, you just can't take no for an answer, honestly. Like I remember just people in my past that told me no. I remember that, and I use that to drive me forward so that I can go look back on them and be like, oh, you told me no? Haha, look at me now, a-hole. Like, you can't take bad things and then give up. Like, you gotta keep going. You gotta be stubborn. You gotta just do it. You gotta say, you know what? This is mine. Like, you'll figure it out later, and then you'll be sorry you didn't believe me, or whatever the situation is. But negative things always helped me grow. I remember in high school, there was an advanced anatomy class, and it was a cadaver class where you get to dissect cadavers. And I was like, oh my God, I really want to do this. It's so amazing. And they only let 16 people in because of the number of cadavers they had. And you'd apply and all that stuff. And I didn't get in. And I didn't get in because I was a band nerd. And she only let in the football jocks and the cheerleaders and stuff like that. It had nothing to do with anything other than that. And that experience was like, you know what? I'm going to be a doctor. Like, screw you. I don't need your stupid class, And it's like, you can't let negative things that happen to you bring you down. You have to use them to lift you up and get you to that next step.
And I'm absolutely thrilled to hear that, just because that's how you discover new things about you. That's how you discover new things, how to help other people. And that's really just the drive that people takes with them all the way till today and even into the future. So that is amazing. Proov, Amy Beckley, where can we find your stuff? I know you did do a couple of talks before. I know you have a couple of episodes out there. It's always fun to hear more about you. But where can people find links to you and Proov?
Yeah, so our website is probably the source of truth. It's Proov test.com. We're also very active on socials, Instagram being our favorite, a lot of free education. So we have Proov Test on the fertility side. Then we have Proov Perry, which is our newest product in the menopause space to help women in their 40s with their hormones. A lot of YouTube content. We're on Amazon. I mean, everything's Amazon Prime these days. We're also in Walgreens and CVS. So, we're in over 14,000 doors. So probably within 5 minutes to anybody in the US, they can go and get a Proov test and learn about their fertility and not have to wait for a doctor to prescribe or tell you you've waited long enough.
And of course, all of those will be shared in the description notes below. So definitely check out Amy Beckley. Definitely check out Proov. It's all amazing stuff. And maybe one day you'll get to meet Nelly as well. Who knows? But aside from that, thank you so much for being on the show. I keep on saying that, like, I probably could have just kept on asking about when does this happen and cycle, or what's the next product that you guys got to come out. But I think on behalf of myself and on everyone, thank you so much for being on the show.
Yeah, thanks for having me. And I hope people learn something, at least one thing new.
I know we're infinitely times smarter than what we were before listening to this, because more than zero is already a lot more. So anyways, that was such a great story sharing and everything. And for the rest of you, I will catch you on the next one. See ya. And that was Dr. Amy Beckley, founder and CEO of Proov. All the links are shared in the description notes below. Go check them out. If you would like to be on Podcast Room by Software Engineer, reach out to us. Just email contact@perrytiu.com. Can't wait to have you on the show. Once again, thank you so much for listening to Podcast Room by Software Engineer. Don't forget to hit the follow button on your podcast app and leave us a review on Spotify and Apple Podcasts. It's completely free. And if you want to tell your friends about Podcast Room by Software Engineer, that's totally cool as well. Anyways, I am Perry Tiu, and I'll catch you on the next one. Big love.